Hello, my name is Dr. Hugh Moran, and I would like to present to you my poster, 1 Year of Critical Care and Hospital Transfers in University Hospital Limerick. So UHL provides critical care transport service for patient transfers to specialist facilities. This is in partnership with the National Ambulance Service Critical Care Retrieval Services as part of the Mobile Intensive Care Ambulance Service. Anesthesia doctors on call may be tasked with completing these transfers during their shifts. So I used Google Form survey to record the data of the critical care and hospital transfers from September 2024 to September 2025. It was a mandatory part of the transfer to complete the form, and data was extracted from the Google Doc and analysed in Microsoft Excel. A total of 63 transfers were recorded in the study period. January was the month with the highest number of transfers with 10, and the monthly average was 4.8. 37% of the transfer 37 or 59% of the transfers occurred in the night shift between 8 p.m. and 8 a.m. The median time was 12:30 at night. Transfer duration ranged from less than 1 hour up to 6 hours. The average duration was 2 hours. And the 8 longest transfers were all during the day shift. 57% of transfers were for adult patients, the majority of which were transferred to CUH. All 28 paediatric transfers were to Dublin hospitals. Critical events, which are categorised as either medical, referring to the clinical status of the patient, or technical, referring to other aspects. 44% of transfers had no critical events at all, and technical events were more common at 44% than the medical events at 25%. Discussions. The capacity at UHL increased for the 96 additional beds being opened there. This will increase the volume of in-hospital transfers and put additional strain on the critical care workforce. Efficient planning and coordination of these transfers are essential to make best use of the workforce available. Timing of transfers should be considered where possible to optimise the staffing requirements. So in conclusion, 20% of transfers occurred at night, and January had 52% more transfers than the monthly average. 74% of transfers last between 1 and 3 hours in duration. CUH was the most common hospital destination, but Dublin was the most common geographical destination. Critical events occur 54% of the time, but only 25% are medical. And the doctors were able to manage these critical events, with the majority have undergone training to do so. Thank you.